So in this session, we'll deal with the histology of urinary bladder and urethra. So urinary bladder, it is a mucomuscular bag that functions as a reservoir of urine. So it receives urine from two ureteric openings and expels the urine into urethra. The wall of the urinary bladder has three layers: inner mucous layer. So as we are seeing that the wall of the urinary bladder has three layers: the inner mucous layer, middle thick smooth muscle coat, and outer serous layer. The interior of the urinary bladder is lined with transitional epithelium. It shows apical dome-shaped cells, otherwise called umbrella cells, on the liminal surface. Some of these cells may be binucleated. In empty bladder, the cells of transitional epithelium are cuboidal in shape and bulge into the lumen. So transmission electron microscopy, the superficial cells are covered by thick plaques, modified area of apical plasma membrane. The plaque takes dark eosinophilic stain. The lamina propria, the transitional epithelium rests on thick coat of lamina propria. The mucosal folds, empty bladder shows numerous mucosal folds that disappear on distinction of bladder. The thickness of the transitional epithelium in empty bladder may range up to 6 cell layer, and on distinction it may reduce to 3 cell layer because of stretching of cells. The muscle coat or the detrusor muscle, urinary bladder has thick muscle coat that forms a meshwork. Fibers running in all directions. Usually inner and outer layers are arranged longitudinally and middle fibers run obliquely. At the junction of the bladder with the urethra, smooth muscle fibers are arranged circularly to form the sphincter vesicae, internal urethral sphincter vesicae. So serous layer, external surface of the bladder is covered by connective tissue. Only superior surface and part of posterior surface is covered by peritoneum. So the rest of the surfaces are covered by adventitia. So in the region of trigone, the mucosa is thin and firmly attached to the muscle coat. The trigone is derived from absorption of mesonephric ducts, whereas remaining bladder from cloaca. So ectopic vesica is a developmental deficiency of anterabdominal wall and anterior wall of the urinary bladder. In this condition, the interior of the bladder is exposed. Cystitis, it is the inflammation of the urinary bladder. Stones, urinary stones may develop in the urinary bladder because of crystallization of the urinary waste products. So you can see this is the transitional epithelium. You can see this is the lamina propria, the inner longitudinal and outer longitudinal and middle oblique layer, and you can see the serosa with blood vessels. So mucosa, transitional epithelium with umbrella cells, binucleated, eosinophilic plaque coat, lamina propria, and mucosal folds. Smooth muscle, inner longitudinal, middle oblique, and outer longitudinal. Serosa, so covers only the superior and posterior surface. So this is the photomicrograph. You can see here the transitional epithelium, the folds of the mucosa, lamina propria, and the muscle layer. So urethra, mucomuscular tube that carries urine from urinary bladder to exterior. Male urethra longer, 20 cm, female urethra 4 cm. Consists of inner mucous membrane, middle submucosa, and outer muscular layer. Urethra is mostly lined by pseudostratified columnar epithelium except at following sites, namely adjacent to the bladder where lined by transitional epithelium, near external opening where lined by stratified squamous epithelium. So submucosa consists of loose connective tissue. Muscle coat consists of an inner longitudinal and outer circular coat of smooth muscle fibers. Terminal part of the urethra is surrounded by striated muscle fibers that form external urethral sphincter. So if you can see here, the mucosa, pseudostratified columnar epithelium, adjacent to bladder transition epithelium, terminal part stratified squamous epithelium, submucosa, muscle coat, inner longitudinal and outer longitudinal. Terminal part, especially in females, the skeletal muscles form external urethral sphincter, and in males, the membranous part of the urethra in the deep perineal pouch is surrounded by the skeletal muscle sphincter urethrae. Thank you.